Good evening, my name is Yvette Cortez and I am the nurse educator here at the hospital. I'm going to give you guys some new information about a drug that we'll be using here at the floor. It's called Estrogen or Premarin. This drug is used as a hormone replacement when premenopausal endogenous levels of estrogen are low. It's also used in combination with progesterone or alone as a contraceptive. It inhibits hypothalamic secretion of GnRH, which inhibits pituitary secretion of FSH and LH. When the gonadotropic hormones are absent, ovulation and conception cannot occur. It produces cervical mucus that resists penetration of the sperm. This drug may be prescribed to patients with deficiency states such as adolescent girls with delayed sexual development, or with women of reproductive age such as patients of age 12 to 45 who do not have periods or abnormal uterine bleeding. Some of the most adverse effects that occur with the use of estrogen are increased risk of thromboembolic conditions such as a thrombophlebitis, pulmonary edema, cerebral thrombosis, and coronary thrombosis. It stimulates blood clotting. They are more likely to occur in women who are older than 35 or those women that take oral contraceptives and smoke at the same time, women who are in menopause that take these long-term estrogen and progesterone therapy, and men and women who receive large doses of estrogen for the treatment of cancer. The long-term use of estrogen alone or with combination of progestin is no longer recommended because of the potential adverse effects that can occur with this drug. Do you guys have any questions so far?
What are other potential adverse effects?
Other adverse effects include menstrual disorders, GI upset such as nausea, vomiting, abdominal cramps, and bloating, but nausea usually subsides within 2 weeks of use. They can also get gallbladder disease, and they may experience migraine headaches, dizziness, mental depression, edema, and weight gain. Endometrial cancer and breast cancer also increase. Therefore, estrogen should not
the lowest dose with the shortest amount of time possible, because it can increase the risk of endometrial cancer, myocardial infarction, stroke, DVTs, pulmonary embolism, dementia, and breast cancer. Okay, so if I understand this correctly, estrogen is contraindicated for patients with intact uteruses, patients who have cardiovascular disease, patients with estrogen-dependent cancers, and those who have dementia? Well, it should not be used for the prevention of dementia, but yes, you are correct. Is there any more questions you guys have? What are some of the important assessments that the nurse should do? Well, for any patient that is considered high risk, for those that we have previously listed, the nurses need to assess their
blood and their pregnancy status, because it is considered a pregnancy category X, so the patient should not be pregnant. You should also assess the lipid panel, as well as having a breast examination and a mammogram and a pelvic examination. Do you guys have any other questions?
So what are some of the important teaching information?
Well, all the information that I have previously provided to you guys is important to tell the patient, but it's important to always tell your patient that it's important to assess their weight weekly and to report any sudden changes to their physician, because it could indicate edema or fluid retention. They need to report any unusual vaginal bleeding immediately, and they need to understand that smoking increases their risk for a thromboembolic event, and they need to understand that the signs such as abdominal pain, chest pain, headache, eye changes, and severe leg pain need to be reported to their physician immediately. If estrogen is taken long-term, patients need to report any unusual vaginal bleeding immediately, and they need to understand that smoking increases their risk for a thromboembolic event, and they need to understand that the signs such as abdominal pain, chest pain, headache, eye changes, and severe leg pain need to be reported to their physician immediately. If estrogen is taken long-term, patients need to have breast examinations and pelvic examinations annually and have their blood pressure checked routinely. Is there any more questions that you guys have?
No.
Okay, well, I have this pamphlet that can be given to your patients to help you educate them. So if you guys would like to take one, feel free to take them there at the center of the table.